So hello everyone, we are having Dr. Priyanka Rajput with us. She matched in family medicine program this year in Match 2021. And Priyanka will share her experience of the match journey as well as importance of research and our experience with us. Welcome Priyanka and congratulations on your match. I'm so happy to have you here. Uh, you can,
Yeah,
yeah,
so much. Yeah, thank you so much, Urvish, for this opportunity. And yes, thank you so much for the support when I was going through the process. Continuous support from your team. Yeah. So hi guys, I matched into family medicine this year, and with all the red flags, usually people say that you have old year of graduation, you have below average score, you are visa required candidate, but I would say it's a dilemma. If you are very dedicated towards this any one specialty you are interested in, and you will match into that specialty if you're very dedicated and hardworking and you don't give up on your dreams.
right. So
That's
which
what happened.
specialty do
I sorry, yeah, go ahead.
No, go ahead. Go ahead.
So I have over seven. I just explained, to Urvish that I have over 7 years of work experience, but I never had any research experience till last year. And when I was going for my step to CS exam, it got cancelled because of COVID. I was very sad, and my all rotations got cancelled at the same time. I was looking for any opportunities, and I went out and I spoke with all my mentors, my seniors, and one of the friends suggested Urvish's research team. And they said, go for that program. They will help you to get any research experience especially during COVID 19. And I spoke with him. I learned about this wonderful COVID 19 research he was just about to start. And, I just start my journey with research. Yeah, I mean, you can ask me if you have any questions.
Yep. So we would love to know your inspirational story or your um, journey from the beginning to the match.
Definitely. So, I graduated in 2012. I'm an ING from India. I immigrated to Canada after that. Started working as an ultrasound technician because I had license in that. I After that I met this wonderful family physician. I started working with him, and since 2016 I have been actively working in the family medicine practice in Canada. So I have done mostly outpatient, a lot of procedures with him. I have worked in different I would say departments of family medicine, because most of us from India, we don't know what family medicine is. Most of us has this idea of doing internal medicine and specializing in going for GI, but family medicine, there are lots of future aspects, because we treat everyone. We treat kids, OBGY patients, geriatric patients, and that's what made me go only for family medicine. I saw lots of addiction patients. I've seen a lot of geriatrics patients, newborn baby. They came for the postnatal care. I've done a lot of procedures which are outpatient based under the care of that family physician in Canada. And at the same time, I also worked in a telemedicine clinic in Canada. And especially during that time, I worked independently. So I have to see my patients on my own, do their physical examination, and then try to connect with the physician online and, do all this case presentation. And I would say, all this work experience helped me a lot. But until last year, I thought of doing research, and many of my friends, they said, you don't need to do family you don't need to do research in family medicine. But I just thought, it's an evidence based medicine. Even as a family physician, you are the first responder to all the patients in a community. If you can look for any specific cause, any specific reason why patient is having this particular disease, it's gonna help only the community to identifying the risk factors. And that's how I decided to join research updates. I got involved into this research, especially based on COVID-19 complications and their possibilities as potential triggers of stroke. And it was a meta-analysis, and during this research study, We evaluate prevalence and outcome of COVID-19 related cardiovascular complications and secondary infection. So we did that. Most of the work was done remotely, and I attended classes with Urvish. I asked a lot of questions during this experience. Any questions I have, he was always there to help me
Late night classes.
understand.
Late night classes we had it.
Oh yes, yes,
Late
definitely.
night class.
Very.
Oh yes, that's great. So the great thing you said that you had all that characteristics of red flag, or I can say
Mhm,
so-called red flag, and people are having common belief that year of graduation, old year of graduation, low score, or visa required category, those are the no to family medicine. But still, you feel that if you are working properly, you plan your years and you work towards that, the family medicine is uh, a good choice as well.
mhm,
So that is one good thing that we will learn about that. The second thing which you talk about a little bit, which I would like to explore more, that you said in the family medicine, you gain the experience like completely dedicated to family medicine in terms of some of the outpatients, some of the telemedicine establishment, paid experience, free experience. So tell me some of the options that you choose in order to make your CV strong. Because I agree with you that research is one of the option as well among that. And of course, ECFMG or AMC res application is having publication section. When you are applying for family medicine, that means section is not there just to show off. The section is there to fill it up, whether it's family medicine or any other. Otherwise, they would not put that section over there, right? On top of that, evidence-based medicine is the number one thing which, firstly, family medicine doctors are going to encounter to their patient, because patient will come first to family medicine doctor before they are going to anywhere else. So I agree with you. You exhaust all your choices, including research, including outpatient or tele or whatever,
mhm.
before you apply. That is a good thing you said. But tell me a little bit more about what are the wide range of things you did it, like this is could be the thing you can do it, this could be the thing you can do it, if you can imagine some of the
Mm,
options.
I would say, when I was new to this country, my main goal is to volunteer for the community. And that's how I actually got a trained volunteer position with one of the best university in Canada. And they developed this program mainly for geriatrics population. And my responsibilities at that time was to go to their houses, take their history if they're encountering any difficulties, and everything was under the guidance of this family physician. So that was one of my volunteer experience. um, at the same time, I also had an inpatient hospital volunteer experience with one of the best hospitals. Here we mainly, I volunteered for the dementia care patients, and that also gave me a little bit of insights about how to, how geriatric patients go through while they're staying in the hospital. At the same time, I would say, I had a huge gap between my graduation and, getting into the residency, but I have always kept working towards the healthcare field. Even if I'm not being a physician, I'm doing some type of volunteer work. I'm teaching students. So I have license in ultrasound. And at one point I was actually teaching students how to do ultrasound, what are the tricks. So I was a teacher for a few months. That was also my one of the extracurricular activities I've done. So, being a family physician is just you're a physician for that community, but you have a different role. You are an educator, you are a teacher. So you have to focus on the preventive care of the community. You have to also deal with the diseases. So I literally have realized, that's what, again, I wanted to do that. And I have done that in past, and I know what will be I doing after I finished my residency. And at the same time, research is a must, because if you just keep working and you don't know what you're looking into, you have to know your patients, you have to know what type of risk factors they have, what can be prevented. And that's when research plays a very huge role,
Yes.
because that when you can do, when you're actually practicing, you can you can literally identify the causes. That's where all
Okay,
the
makes sense.
preventive care comes from.
Makes sense. And most of the candidate I have encountered with, they all are keeping family medicine as a backup option. I heard from most of them, they are like dual application candidate. And when I meet you from a day one, you are like, no, I don't want to be the part of this. I don't want to be a part of that. I just want to do this thing for family medicine. So tell a
Yes.
little bit to the people, to the physician who didn't match, how family medicine could be the isolated or independent specialty where you can make your profile from a day one to the day you match rather than keeping it as a secondary application.
See, when you actually go for the interview, they know. They will ask you certain questions in indirect way. They will know that it's a backup program. They
Right.
will know from your CV that yeah, this person also has experience in this. So they will know right away. So you are, if you're keeping it as a backup, they will identify that and they will not rank you. And for me, my profile was completely family medicine. All the volunteer work was in family medicine department. All the work experience was in family medicine. Even the research was, it was possibilities of, so it was also all medicine
Everything was in
related
family.
experience.
Right. So, though you are old year of graduate, but what I think is a positive point for you was though you take a longer time to apply, but this is the first shot and then you match, right? If I'm not wrong.
Yes.
So this is
So
the first year of application, and you hit on the right time on right uh, way so that you can match on a first shot. So you prepared for that application for several years in different work manner. Probably that's what I noticed that, right?
exactly, this is exactly correct because I loved everything when I graduated from India and I wanted to do everything. I wanted to treat a pregnant female, I wanted to treat kids, and I loved primary care. So when I realized that internal medicine you cannot treat OBGY patients and pediatric population, that's when it hit me and I decided, only family medicine, it's my love and
Yeah.
I'm gonna follow what I believe in.
That's great. Yeah, that's very true. And also, I remember we started our journey together in all the way in October. Once application like almost completed, right? So we started
Yes.
research when, or even observership when you are doing. I remember that you started doing those things later on, right? So,
Yeah.
what's your take on that? That people are thinking the September is done, no more research, no more observership, but on the contrary to that, you join October batch. So now tell me a little bit about that, like how the research in October help you to match.
So, okay, I was in touch with you. I was asking you about the questions, when should I start? And yeah, I started my experience in October. And I just learn a lot, but at the same time, you're always confused that will it help me, will it not help me, what should I do? But I'm a positive person. I said, you know what, let me have this experience, even if it helps me or doesn't help me, let me go with the flow because I want to learn. That was always my backup mind.
Mm.
For any experience you learn and research, so just we did publication, and I was able to add that in my CV. So I had those things empty when I was going through my era CV. I saw, oh, I don't have research. And I said to myself, I cannot keep anything empty because I have a lot of other red flags. And that's why I decided to research. And during this whole process till match, till the last time, because the research got accepted with some edits. So I emailed that program director just before this rank of list, and I told them. So it was, it's not that you only do it till October. You have to keep updating the program you are interested in about all the progress you're doing, whether it could be research, any new changes, if your article got published, if your article got accepted, if you publish, you can send them the article, which I did. So
Yes.
it's and yeah, Urvish, he just sent me last moment. It's like,
Yeah,
okay, okay,
yes,
this is
I was
going
surprised. I was like, why she's asking the major changes and minor changes to send it to the program? I mean, who sent minor, major changes to the program? The
good.
revision
Yeah.
of the article. But yes, now I got the point.
Yes, because the I always wanted to go to this particular program, and That's why I wanted to be very truthful to them that, okay,
Right.
I have this, it's not that I'm hiding anything. Yeah, I have done this, I have gained this experience, and this is the research I have, put all my hands in. I know everything about it. So if you're trying to do any type of research, know ins and out of the research. That's what you need to do, just like the specialty you choose.
Makes sense. No, completely makes sense. Any particular advice for the people who didn't match in family medicine and having year of graduation, maybe old, low score, any particular
I,
thing?
match can be very unpredictable. I have seen many of my friends with more than 10 interviews don't go, they didn't match. And I, including myself, with just a number of 2 or 3 interviews, you're gonna match. So you don't need
Yes.
20, 30 interviews to match. You just need one opportunity, you just need one program to match.
Match. Yes.
And it's not about giving up at this moment. You have came all the way, just always think about the reason why you chose this pathway and why you didn't give up till
Makes
now.
makes
This is
sense.
not the time to give up. This is the time to just pick yourself up. And it's all about hard work, perseverance, and dedication.
Makes sense. Makes sense. Yep. Your journey with Research Update organization. How did the program help?
So that program helped me a lot because I learned how to collect data. It was a remote experience, first of all. So many of us think, oh, I have to go to the hospital only to gain research experience. No, especially during COVID time and even current time, you do a lot of things remotely. I learned how to collect data, how to learn how they do analysis of the collected data, how to use this particular SPSS software, how to use these guidelines to follow proper procedures to publish. So I learned a lot during this experience,
Yeah.
and it was amazing because you meet a lot of new people. You learn about what are they thinking about the research. Everyone get together, and that's the way of work. Everything works like that in this country.
Yep.
Teamwork.
That's great. That's great. And are you planning to go for fellowship or direct practice? With
Right now, it's very uncertain. I wanted to just go for practice right away,
Mhm.
but if I'm in the program and if I get the opportunity, I will definitely go for the fellowship.
That's great. That's great. Awesome.
Yeah.
So thank you so much, Priyanka, for your time. And we
No,
really
thank you so
appreciate
much.
that thing. Okay, we'll see you then. Thanks.
Thank you so much for having me, guys.
Yep.
Bye.
Bye.